So this is a different type of video. I wanted to go over more of health insurance and what some of these terms mean and how this affects you. So first off, going over the fact that this video does not include everything about insurance. This video does not necessarily specify to the plan that you've chosen. So every plan varies, and look into your individual plan. But a couple terms I want to go over just so we're all on the same page. So a premium premium is the number that you pay on a monthly basis to be able to have this insurance policy. And when you go into your provider's office, that really isn't an applicable number, but that's a number that you may want to know for what you're paying each month. First number would be a deductible. That one's going to be when you go into your medical provider. Sometimes it's an all-inclusive medical deductible, and that could be $1,000, $5,000, whatever the number is. So that number has to be met before the insurance is going to kick in and help you. And going into kind of the next topic on that would be coinsurance. So for example's sake, your coinsurance is 20% per visit. So in this example, all right, there's a $1,000 deductible. That has to be met first. And then if that visit was $100, you would pay $20 of that visit. Insurance would pay the other $80. And so that's how those correlate. A coinsurance typically has to have the deductible met before it's going to help out. A copay, on the other hand, is most of the time it's a separate topic. It's like a $25 payment. So every time you go in for a visit, you pay $25, and usually not applicable to that deductible. So whether you've met it or not, you pay $25 each visit. So those are the three big terms that come into play. Is again the deductible, which is typically that first number. Coinsurance would be a percentage of the visit versus a copay, which would be usually a flat fee. For the most part, each of those are the big numbers that you're looking for. And in the sense of choosing a plan, those are the things that you're looking at. So in the sense of how to choose a plan, look at kind of how you typically use health insurance. So each plan is good for certain people. For example, if you're someone who's really healthy, never really go to the doctor, don't have any big problems most of the time, you may want one of those plans where it's a lower premium, but everything, that deductible, copay, coinsurance, they may be pretty high numbers, but you're not using them very often, which would be more of what's considered like a catastrophic plan. Versus someone who's going into the hospital, has regular care, lots of things are going on. You may be one of those people who wants a higher premium, so you're going to pay more each month in order to have the benefits a lot lower. So you have a $0 deductible or $250 deductible, or everything's a little bit lower. That way you're not paying a lot each visit you go in, but you pay more each month overall to be able to cover that. So those are kind of two, again, spectrums. Everyone's a little bit different. You kind of have to play the gambling game a little bit on what do you think you're going to use more of, because typically every January, again, everyone's a little different on when they do this, but for the most part, January is that reset period. So if you have a $5,000 deductible, and you spend $4,999 on December 31st, they're not going to cover anything, and that resets on January 1st. So you've got to start all over. And I guess speaking of, sometimes you'll run into that scenario where you meet that deductible and then there's another term which would be an out-of-pocket maximum. That would be a, again, example-wise, $5,000. So if you did medical services and it met $5,000, you've met your out-of-pocket maximum, so you're not going to pay any more for any of the services above and beyond that. So that copay, coinsurance, whatever that number is, you don't have to pay that anymore. They're going to pay the rest of it. So things to look at. Those are your big terms to watch out for, just so you understand what you're looking at. The other one would just be in the sense of chiropractic in general. I've seen some of those coverages start decreasing the amount of visits or lumping them with other things. So how you want to use it makes a big difference on which plan you're going to use. But when coming in for treatment, those are kind of the common terms you're going to hear, and be able to understand that to try and understand what's going on. So insurance is definitely not a super clear world, but this gives you an idea on what kind of some basics on what to know, what to look for. And if you have any questions, feel free to ask and we'll try and get those answers to you. And I'm Dr. Darren Howarth with Summit to Shore Chiropractic. Let me know if you have any other questions. We'll see you soon.